We have seen that the muscarinic receptor, the five types of muscarinic receptor, M1, M2, M3, M4 and M5. Out of that, M1, M3 and M5 are stimulatory and are coupled with GQ protein. M2 and M4 are inhibitory and are coupled with GI protein, and M4 and M5 are exclusively found in brain. Now let's look how GQ and GI protein intracellularly work. Right, if let's suppose this is M3 receptor in the eye, it is 7 pass receptor, this is M3 receptor, and it has to be coupled with GQ protein especially, uh, has three components. They are alpha, beta and gamma, and they are all attached to each other, alpha, beta and gamma component, initially the GQ protein in the inactivated state. Now as soon as acetylcholine comes, right, and binds with the muscarinic receptor, the M3 receptor, let's say, it would send the intracellular signal, and the intracellular domain, let's say this is a whole cell and this is the intracellular domain would stimulate the GQ protein, and initially the alpha component of the GQ protein has GDP attached to it. So after stimulation, the GDP would go away and GTP would attach to the alpha subunit. Now as a rich man, alpha subunit now is a rich man, so he will leave their poor friends. So alpha rich with GTP is now alone, and he will release their poor friends, right? And this alpha subunit along with GTP would stimulate something very special found in the cell membrane. This is called phospholipase C. This phospholipase C is, we can say, it is a cell membrane cutter like something, that it would take one of the lipid in the cell membrane and convert it into PIP2, that is phosphatidylinositol diphosphate. And after PIP2 conversion, the PIP2 will again get converted into IP3 and DAG. IP3 is inositol triphosphate and DAG is diacylglycerol, and out of that diacylglycerol will stimulate phosphokinase C, and this phosphokinase C will phosphorylate the channels, and so that the calcium influx can phosphorylate the calcium channel, so that again calcium influx can take place. And in similar fashion, inositol triphosphate would sequester out the calcium from the endoplasmic reticulum. Let's say this is the endoplasmic reticulum, right? And from that endoplasmic reticulum, the inositol triphosphate would activate the calcium pumps, so that calcium is pumped out, and now this calcium will bind with the calmodulin. This will form calcium calmodulin complex, and it would activate CAM kinase, right? And this CAM kinase would again phosphorylate the transcription factor, which would create more protein for the contraction of the muscle, or it would phosphorylate the calcium channel, right? This is the calcium channel, it would phosphorylate so that more calcium can come. So once now more calcium is coming inside the cell, this calcium would be utilized in contraction of the muscle. So let's suppose this is the eye, right? Eye. And in the eye, these are the constrictor pupillae muscle. Now once you administer acetylcholine into the eye, the constrictor pupillae will have M3 receptor, and these M3 receptor will sense the acetylcholine. They will give the intracellular signaling, and this intracellular signaling would be GQ, and out of that alpha unit will lose GDP and GTP will combine. The GTP will combine, and the rich alpha along with GTP will now go and activate phospholipase C, and it will leave poor beta and gamma units. Now this phospholipase C will eat one of the lipid from the membrane and release phosphatidylinositol diphosphate, and it will convert into inositol triphosphate and diacylglycerol. Out of that, diacylglycerol will activate protein kinase C, and this protein kinase C will again, kinase means kinase activity is always related with phosphorylation. So this protein kinase C will phosphorylate the some of the calcium channels, and calcium channel influx would be there, so that contraction of muscle can take place. Inositol triphosphate would sequester out the calcium, and it would bind with calmodulin, forming calcium calmodulin complex, and it would activate CAM kinase, so that once again it can phosphorylate the calcium channel, so that calcium influx can take place. Once the calcium is inside the cell, now these calcium can be utilized in excitation, contraction, coupling. So once acetylcholine is administered, this constrictor pupil will contract and pupil will constrict. So this is how GQ protein work. Now let's find that how G inhibitory protein is working. G inhibitory protein is also a 7-path receptor, right? Let's say this is the G inhibitory protein, and to this acetylcholine is binding. So out of that G inhibitory protein, these also have intracellular domain, and this intracellular domain would activate G inhibitory. G inhibitory has also have three components: alpha inhibitory, beta inhibitory, and gamma inhibitory. Again the same story, initially it was bounded with GDP, and after stimulation it would bind with GTP, and alpha inhibitory along with GTP will lose their poor friend, so this is beta inhibitory and this is gamma inhibitory. Now alpha inhibitory has some special effect on this special enzyme. This is adenylyl cyclase. Alpha inhibitory will go to adenylyl cyclase and inhibit adenylyl cyclase. Alpha inhibitory. Once alpha inhibitory inhibits adenylyl cyclase, there will be no more conversion of ATP to cyclic AMP. So the levels of cyclic AMP would go down because adenylyl cyclase is inhibited. Since there are low level of cyclic AMP, there will be low level of protein kinase A. Since there are low level of protein kinase A, there will be low level of phosphorylation of the calcium channel. There will be no phosphorylation of the calcium channel. There will be no calcium inside. So it will again create hyperpolarization because it doesn't allow calcium to come in. Hyperpolarization. Next reason for hyperpolarization is that beta and gamma inhibitory unit phosphorylates or activates the potassium channel. These are the potassium channel, so that more and more K plus efflux is seen. K plus efflux is seen, so that because of this K plus efflux there is more hyperpolarization inside the cell. So this is the next reason for the hyperpolarization and deactivation of the cell, right? So this is how GQ and GI works. Now let's look what will be the effect on individual organs, and the what will be the effect of site, what will be the effect on site where the muscarinic receptors are found. We'll look acetylcholine as a prototype, and generally acetylcholine is released in the body when the parasympathetic nervous system is activated when you are relaxed, right? So we'll think intuitively that when you are relaxed, right, when you are sleeping inside your sorry when you are sleeping on your bed, when you're sleeping on your bed and relaxing, you're listening to music, and at that time you need dim light, right? If you got dim light, you'll be more comfortable. So you want your pupil to accommodate constrict in such a way so that less light goes inside it. So your pupil in relaxing condition should ideally constrict. In order to constrict pupil, you got to activate constrictor pupillae, and since you need to activate that, activation receptors are M1, M3 and M5. Since M5 is found exclusively in the brain and M1 is found in the ganglia only, you are left with M3. So constrictor pupillae has M3 receptor coupled with GQ protein, and again it will constrict, right? So first thing is that your pupil constricts as soon as you are relaxed. Second thing is that um, when you are relaxed, your near vision would be more appropriate, so that when you're relaxed and you are sleeping on your bed, so that you can easily, let's say, you can easily read the novel, right? So this is the condition when you are relaxed. And now when you are relaxed and you want your vision to be near vision, you should have the curvature of the lens to be more. Now in order to have your lens curvature to be more, you got your ciliaris to be contracted. Now what happens if your ciliaris contract? Let's suppose your ciliaris contracts to this position, right? This was the initial position of ciliaris, and now this is the position of ciliaris after contraction, right? So the zone, these are the, this is the ciliaris, these are the zonules, and this is the lens. So once the ciliaris is contracted, the zonules would become relaxed, because the distance, now let's say this was the initial distance a and a dash, and this is the final distance after contraction, a2 and a2 dash. Now this distance is intuitively more than this distance, so that more the distance is there in a, between a and a dash, there be more distance, so that more contraction in the zonules would be found. And since after contraction the distance is decreasing, the zonules would get relaxed like this, because there is less distance, and the lens would get globular in shape. Once the lens is globular in shape, the near vision is appropriate. So this is how you'll achieve near vision. And since you want to contract your ciliaris, you got to have a stimulatory receptor. Once again, they would have N3 receptor. N3 receptors are found in the lacrimal gland as well. So whenever you're too much emotional or too much parasympathetic outflow is there, you start crying, right? So lacrimal gland also has M3 receptors. Next thing, when you are relaxed, what do you think about your respiratory rate? Respiratory rate should be as fast as whenever you have dog behind you, or your respiratory rate should be low. Intuitively, your respiratory should be as low as when you are comfortable. So to to make your respiratory rate low, the bronchial tree should constrict, so that your respiratory rate become low. And these are the bronchial smooth muscle. In order to constrict bronchial smooth muscle, you again got to have M3 receptors in the bronchial smooth muscle. Next thing is the about the bronchial glands. Bronchial glands get activated only when you are relaxed. So these bronchial glands also have M3 receptor. And since when you are relaxed and when acetylcholine is released, these bronchial tree gets constricted. That is why the cholinergic drugs are contraindicated in asthma, because if you give cholinergic drug, they would uh, the result in bronchospasm. That is why it is contraindicated. So this was the action in the bronchial tree. Next is in the heart. In heart, generally in parasympathetic nervous system, you need your heart rate to be low, and so that if you want your heart rate to be low, there will be something that should inhibit, and the thing which would inhibit is either M2 or M4, but M4 is exclusively found in the brain, so you are left with M2. So that M2 is found in the SN node or AV node or in the atria, right? Less amount of um, muscarinic innervation, muscarinic receptors are found in the ventricles, more are found in the atria and SN node and AV node. Since they are coupled with GI, there will be hyperpolarization of the SN node, so there will be negative chronotropic effect. There will be hyperpolarization of the AV node, so there will be negative inotropic effect, right? So there will be again there will be negative bathmotropic effect as well, and clinotropic effect as well. This was the action in the heart. About the stomach, you want to, when you're relaxed, it is the sign, it is the time when you want to digest, so that you save your energy for digestion later. So when you're relaxed, you want your food to be digested, so that the muscle of the GIT should get activated. So again, they should have M3 receptors. Of course, you only urinate when you are relaxed, unless pathological. So again, the detrusal muscle should be having M3 receptors, right? The detrusor muscle contracts, and obviously the sphincter would relax. In order to relax your sphincter, you should have again M2 receptor, because they are inhibitory, right? This was about the, again, the defecation is also primarily cholinergic, because M2 receptors are found in the sphincter, so that sphincters get relaxed. Also, there is one more important action in the blood vessel, is that M3 receptors are found in the endothelium of the blood vessel, so that once M3 receptors are found, M3 receptors are coupled with GQ, it will ultimately act on phospholipase C, and then phosphoinositol, phosphatidylinositol diphosphate, and it will increase IP3 level and diacylglycerol level, and again this would activate calcium channel. Now these level would activate nitric oxide synthase. Once nitric oxide synthase is activated, it would convert arginine into citrulline and nitric oxide. This nitric oxide is also called endothelium derived relaxing factor. Once this nitric oxide is formed, nitric oxide acts on the endothelial smooth muscles, the smooth muscles of the blood vessel. Let's see how. Let's suppose this is the smooth muscle. Nitric oxide would go inside the smooth muscle, and it would activate cyclic GMP. This is also called cytosolic GMP. I'm sorry. Nitric oxide would activate guanylyl cyclase. Once it will activate guanylyl cyclase, it would convert GTP to cyclic GMP, and once this cyclic GMP is activated, it would activate protein kinase G, and this protein kinase G would phosphorylate mass in light chain kinases, and thus it will relax the smooth muscle. So if you inject acetylcholine in the blood vessel, the blood vessel would dilate because of nitric oxide, because nitric oxide would activate protein kinase G, and it would phosphorylate the myosin light chain kinases, so there will be relaxation of the smooth muscle. That is why you find flushing in the face, or after the injection of the after the injection of the cholinergic drug, you might find the flushing in the face. So if hypothetically you inject acetylcholine, generally acetylcholine is not injected because it is readily destructed by butyrylcholine esterase. I think we should talk about that at this special moment. Generally, acetylcholine is degraded at neuroeffector site by um, acetylcholine esterase, but acetylcholine in plasma, it is degraded by pseudocholinesterase, or it is also called butyrylcholine esterase. So that is why we don't inject acetylcholine intravenously, because it is readily distributed by butyrylcholinesterase. But hypothetically, if you want to see the action of acetylcholine, what will happen? First of all, there will be a lot of sweating. We didn't discuss about the sweat gland, but sweat gland are also supplied. Sweat gland are actually post-synaptic, post-ganglionic sympathetic fibers, which are cholinergic. But this is since this is cholinergic, this would activate the sweat gland. So number one would be excessive sweating, since all the glands such as lacrimal glands are also receiving the cholinergic supply. So there will be excessive, say, lacrimation and salivation, and the pupil will constrict, and it would accommodate for near vision. Contraction of cilia is also called cyclospasticity, and overactivity of cholinergic drug on the ciliaris, it would create a condition called cyclospasticity. Also, the bronchial tree would constrict, there will be bradycardia, there may be abdominal cramp, or there will be vasodilation and flushing, there will be urination, defecation. Also, one more important thing, since they are dilating the blood vessel, and during erection of the male and female, right, generally in male the penis is erected when the parasympathetic nervous system is dominating, and that is because of this activity, because nitric oxide is released, and nitric oxide mediated vasodilation is there in the penis. So this is how there will be erection in the males, and in the females it would activate the glands in the uterus, so there will be vaginal lubrication as well. So you'll have erection in the male and vaginal lubrication in the female when they are when the parasympathetic nervous system is dominating. So this was the effect of hypothetically acetylcholine uh, in the different parts of the body, and how the receptors modify them. Thanks for watching.